This is some bonus material on a report from Dr. David Perlmutter's The Better Brain book. This special bonus material is on multiple sclerosis. Multiple sclerosis is a progressive disease of the central nervous system that's typically diagnosed between the ages of 20 and 40, although it can strike other ages. It's believed to be autoimmune, though there are many questions about the disease still. Two-thirds of those affected are women. What we do know is the immune system begins to attack myelin. We don't know exactly why, but there's good evidence that the immune response may be triggered by a virus or bacterial infection. The most convincing evidence of this to date is that one bacteria, in particular Chlamydia pneumoniae, which is a fairly common bacteria that is the cause of pneumonia, pharyngitis, and bronchitis, and several chronic diseases, was found in 100% of 37 MS patients in a particular study at the Vanderbilt School of Medicine. Antibiotics are not a cure for MS, but wiping out a possible bacterial trigger may help restore more normal immune function, and Dr. Perlmutter puts all his MS patients on an antibiotic for this particular bacteria. Another type of microorganism that could play a role in MS is Candida albicans, a type of yeast infection. Several studies have suggested a link between yeast overgrowth in the intestines or gut and autoimmune infections in general. Yet, there is an epidemic of yeast overgrowth today, primarily triggered by the high amount of refined sugar in the diet from processed food, as yeast loves sugar. If you take antibiotics for MS or any other problem, it's important to take supplementary good bacteria, also known as probiotics, to maintain normal ecology of the gut. I believe Dr. Perlmutter believes that all MS patients should be checked for yeast overgrowth and treated appropriately. He's not suggesting that this is going to cure MS, but if you correct the imbalance in your gut, it is an important step to reducing a potential irritant and improving your immune system. In hyperbaric oxygen therapy, patients are exposed to pure oxygen under increased atmospheric pressure. Treatments usually last 60 to 90 minutes. In 1982, a groundbreaking article published in the New England Journal of Medicine reported on a one-year randomized, double-blind, placebo-controlled study of MS patients receiving hyperbaric oxygen therapy versus a group of untreated patients. Only 12% of the treated group had worsening of their symptoms, as compared to 55% of the untreated group. Gluten is a protein found in many different grains, including wheat, rye, barley, buckwheat, amaranth, and spelt. At least 1 in 250 Americans is gluten intolerant and suffers from a condition known as celiac disease. For these people, gluten can cause significant neurological problems, including telltale white lesions seen in MRIs of the brain that are similar to the kind of damage seen in patients with multiple sclerosis, as well as memory loss and confusion. Dr. Perlmutter has had patients for whom removing gluten from the diet for a few weeks had his patient's symptoms of MS disappear entirely. Gluten can affect every part of the body, from the bones to the brain. Dr. Perlmutter suggests that for anybody who has MS or suspects they have MS, one of the first things they should do is be tested for gluten sensitivity. The right dietary protocol can reduce the need for drugs, slow down the progression of MS, and substantially prolong remission periods in many people. Dr. Perlmutter is an adherent of the Swank MS diet, which was designed more than 50 years ago by Dr. Roy Swank. He was the first to discover a correlation between the consumption of dietary fat, especially saturated fat, and the incidence of MS. Dr. Swank noted that if treated early in the disease before significant disability has developed, a high percentage of cases remain unchanged for up to 20 years. So the Swank diet is low-fat, vegetarian-based diet that allows only a small amount of saturated fat from meat, eggs, and full-fat dairy products, and emphasizes good polyunsaturated fats found in vegetables, seeds, nuts, and fish. Although the disease is not well understood, as you can see, there are many things you can investigate and do which may improve your situation.